closed surgery called hysterectomy can be done by different surgical techniques. One is the vaginal route, the other one is the open surgery, which is called laparotomy. The other one is called closed surgery or laparoscopy. The healing period during different techniques of surgery also affects the patient at home. If it's done by vaginal route, it's usually much easier when you go home because there is no pain or very little pain. If it's with closed surgery called laparoscopy, then it's much easier than the open surgery. If you are undergoing a laparoscopic surgery for hysterectomy, when you go home, there are very small incisions in your abdomen. These incisions don't need any care after you go home. There is no need to removal of the stitches. But if you're undergoing hysterectomy with open surgery, then the incision is quite bigger than the closed surgery. It's 10 to 12 centimeters, but it's in the lower abdominal area. These stitches might cause more pain. When you go home, if you need painkillers, the doctors when you will prescribe you pills for painkillers, and these painkillers can be taken for 4 to 6 hours every day, 3 to 2 times. But during a hysterectomic surgery, you need to take care of these stitches. You need to check these stitches every day to see if there is any leakage or redness in this area of the surgery site. If there is anything like that, you need to call your doctor because we already prescribe you some antibiotics after surgery. But if there is leakage or redness in this area, then you might be having a kind of infection. So the doctor needs to check the incision area. When you go home, you shouldn't stay in bed for long hours. After any kind of surgery, there is always a risk of thrombolia, which causes blood clots in the vessels. For this not to happen, you need to move around home, drink a lot of water, and just every 2 hours you should just go around walking the room so you can heal better. Drinking a lot of water and mobilization helps you heal better in shorter time. If the doctor gives you other kind of injections to keep the blood clots, to keep you safe from the blood clots, this should also be done daily as taught to you. Another problem during daytime at home after this kind of surgery is taking a bath. You don't need to close the incision area when you're going to shower. There is no need to put anything on the incision side when you're showering. But after you go out of the shower, you should check the incision side and you can just dry with a clean towel that area. You can take the bath anytime you want after you go home. But you shouldn't go to spa or hot tubs after surgery. This might cause a little bit hypotension. So after 10 to 12 days, you can take such kind of spa treatments. After hysterectomy surgery, if you are doing active sports, you should wait for 4 to 5 months if it's an open surgery. You can wait 1 to 2 months if it's a closed surgery. If it's a vaginal surgery, it's better to wait 2 to 3 months. If you're lifting weight, too much weight might cause the fascial rupture. There might be another problem at this incision site, so it's better not to have heavy lifting exercises or abdominal pressure increasing exercises. But after 1 month with any kind of surgical technique for hysterectomy, you can go walking around, you can go out and walk and go swimming, and you can also cycle. Cycling is also allowed after this kind of surgeries. But at a very early time, in 1 month of the surgery, you should better stay away from sports. After hysterectomy, if you want to have sexual intercourse, after 1 month of surgery, you can have it. Because there are some stitches in the upper side of the vagina in hysterectomy, in uterine removal. Which way we do the surgery doesn't matter. Even if we do it with laparoscopy or vaginal surgery or an open surgery, when we are removing the uterus, we take the cervix, the lower part of the uterus also, and then we stitch the upper side of the vagina. These stitches need some time to heal, so it's better to have 1 to 2 months sexual intercourse after these kind of surgeries. And if you do it in an earlier time, then you can have some bleeding and you can have some other problems. So it's better to wait 1 to 2 months. If you want to have it earlier, you should better consult your doctor.